Hello everyone and welcome again to the Doctor Show. I hope you're having a good day and a great Tuesday. And today we're gonna keep talking about mental health. We started talking about mental health and we talked about autism in the last episode. But tonight we're gonna talk about another mental health issue. But before I start, I always tell you mental health is more important than physical health. So please make sure to take care of yourself. Make sure to check yourself and go to a doctor once in a while, go to a therapist, and make sure you're perfectly fine. Today we're going to talk about a disease called ADHD. What is ADHD and does it actually stop your life? What does it do? ADHD is one of the commonest mental health issues in children and actually super common in boys rather than girls. What does it stand for? So it actually stands for Attention Deficit Hyperactivity Disorder. What does that mean? Children who tend to be over hyperactive, who tend to not have to finish one task, to tend to actually not finish their task, not actually given attention in class, not all of that, they might have this disease. And it's actually super common when it comes to children. It's actually the commonest mental health issue and it happens quite often. But what are the types of them and what are the symptoms of them? And how do I know my child has ADHD? There are two types of children that have ADHD, inattentive and hyperactive impulsive. What is the inattentive? Inattentive, the one who lacks focus, lacks attention, lacks anything that needs to focus for a long time for one thing. Like what? He's very easily distracted. He tends to daydream when he's sitting or she's sitting or in class. All of that tends to have attention much less, and doesn't follow tasks and doesn't even finish them. Gets bored very easily and doesn't pay attention and makes a lot of mistakes when he does his things. Makes a lot of mistakes when he does his tasks. He has a problem organizing daily tasks and having all of that. What about the other type, which is hyperactive impulsive? The hyperactive impulsive, it has super high activity. He usually bounces on his chair. He's usually always on the go and ready to move and always doing something, does not get tired easily. He always gets mad usually when when he talks or gets irritated fast or makes impulsive decisions. And some people actually have two types, the inattentive and the hyperactive impulsive. Some people have the two types and some people have them both. So please make sure you actually check a doctor when you notice one of these symptoms to your child. What are the symptoms when they actually get older? When they actually get older, things get a little bit more complicated because they might have anxiety and depression because they're not finishing their task in their job. They're not actually finishing the tasks in their office place or in anything. They're finding it difficult to keep on with daily tasks, so they might have some depression and insomnia. So they might actually go to a psychiatrist or a therapist to make sure to get themselves checked. They need to actually adapt with who they are and adapt with this is who they are, and they cannot control it. Even if we actually treat some of the symptoms, a person who has ADHD, unfortunately, it's a lifelong condition. It takes your whole life to actually have it. It does not get cured, so they need to actually know how to deal with it. But before we go to the point of how to deal with it, what are the causes of ADHD? Until now, we don't know what is the reason and the cause of ADHD, but we know that it's in boys more than girls. It doesn't matter your ethnicity, your country, your diet, all of that, it doesn't cause you to have ADHD. But what can cause you to have ADHD? Sometimes it could run in families, and the most important thing, the mothers, when they're pregnant and they have infections, diabetes, hypertension and not controlled, all of that I'm saying not controlled, when they actually take a lot of substances like alcohol, like smoking, all these things could actually affect the health of a child and eventually might cause mental problems just like ADHD. So as we said, it actually could run in families, so it could be your genes, so there's no way to actually go around it and avoid it. What other things? It's basically just the change of the chemical in the brain. How your brain works, it actually works differently this time. What else? Some toxins when people are children, like lead toxicity around the environment that could cause it. Poor nutrition in pregnancy other than the diseases. All these things could actually cause ADHD. Some of them are pretty avoidable and some of them are not. So please, if you have a pregnant lady around, if you are a pregnant person, if you are planning to be pregnant, make sure to avoid all these things because they're actually quite dangerous. What other things we do to treat it, to actually deal with it? If you're a mother of an ADHD child, it's very, 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 very important for you to be educated about it, to know everything about it, to know how to deal with it, to know how to actually understand what they feel and what they do, to understand that they don't control it. They don't control their attention. They don't control all of that. So what do you want to do and what do you want to be? First of all, get educated about his condition. Get educated that you have to accept them for who they are. You have to accept them for whatever they feel and whatever they actually do. What other things you have to do? There are not an actual one treatment for it. There are certain things you should do. Having a medication is very controversial. Some doctors say that it is actually recommended. Some doctors, they say they're not. But other treatments are actually very, very, very useful and important, like what first of all, behavioral therapy and behavioral concentration. What to do is to plan his day. Plan his day, make a perfect routine out of it, that this hour is breakfast, this hour is work, this hour. So they have a routine throughout their day. When they have a routine throughout their day, they're gonna expect what to happen. They're gonna try to be less hyperactive. They're more concentration because they know what's gonna happen. Plan their day and give them a reward for whatever they do. Try to punish them if they don't get whatever they do and give them a reward. If you finish your task and not get distracted, I'm gonna give you this and that. I'm gonna buy you this and that. The reward system usually work with them. Understanding them usually work with them. What other things? Trying to get them tired. If they're hyperactive, then let it be. Give them something to be hyperactive and like signing them up in sports, in group studies, in group workouts. Make them have other activities. Make them play more in real life and physical activity to get their energy out, to get them more tired, to get them do things to happen. What other thing that we should do? Psychotherapy. Take them to a doctor, let them talk to a doctor, let them say their concerns, let them actually talk about other things. Psychotherapy could help a lot, especially in adults. And the last thing is to actually have social skills training. Let them how to deal with people, learn how to deal with people, learn how to actually talk, to deal with the whole around the world around them, because it's quite difficult for them to express everything. Of course, there are way more treatment, way more psychotherapy, and way more solutions for the ADHD, but most importantly, get educated about it and go to a doctor, and the doctor will tell you what to do. And don't worry, it will not affect their mental development, not health development. It's perfectly fine. It's just a little bit of getting distracted once in a while, and that's it. I hope you all stay healthy, and I hope that I actually made this disease a little bit more clear. So please, if you see any of these symptoms in your child, make sure to go to a doctor and not let it slip, because it's going to help them a lot. Thank you very much and have a good day. I'll see you next episode.